The only way to cure a toothache is to kiss a donkey. What if this were true? How many of you would actually be considered ass kissers for the sake of relief? Believe it or not, that was the practice in medieval Germany. Some of the bacteria found in toothaches are also linked to cavities and even gum diseases. Having been a dental hygienist in this field for about 10 years now, I would like to discuss with you how to avoid toothaches altogether, which reduces your chance of developing cavities and other diseases. Today, I'll tell you how annual exams, maintenance dental hygiene cleanings, and daily brushing and flossing can decrease risks associated with various diseases, including cancer. So let's get to the root of the problem, starting with annual exams. The purpose of annual exams is to evaluate your overall health and oral hygiene. During your appointment, the doctor may take dental x-rays or do other diagnostic procedures. This should evaluate your risk of tooth decay, root decay, and gum and bone disease. With early detection of cavities on dental x-rays, the problem can be nipped in the bud before it actually becomes a problem. According to the U.S. National Library of Medicine, tooth decay is the second most common disease in the U.S., next to common cold. The dentist will also address any questions, problems, or concerns that you may have about your oral health. For instance, if you have xerostomia, which is also known as dry mouth, the dentist can tell you how certain medications you may be taking can increase your risk of tooth decay. Or if you have diabetes, for example, you're at an increased risk for gum disease. If you have sensitivity, you experience pain when consuming hot, cold, or sweets, then you should bring this up to the dentist as well. Or even if you notice mouth sores that last longer than a week, you should definitely ensure a doc looks at it to make sure no further action is necessary. Speaking of further action, let's talk more about annual cleanings. Annual cleanings will assist with a second look in finding problems. The hygienist will provide secondary oral screenings. If patients smoke or use any other tobacco products, trained tobacco cessation facilitators can provide counseling on ways to quit smoking or using tobacco products. Tobacco use increases the risk of oral cancer. With tobacco cessation, the patient can learn different ways to address the habit and to beat it, as long as they're ready. According to Murray and Nadel's book of respiratory medicine, tobacco use has also been linked to heart attacks, stroke, infertility, problems with pregnancy, and even decreased ability to taste or smell. Screening should also let you know how well you're doing with your oral hygiene practices or which areas you can improve in. Oral hygiene instruction, OHI, is given to each patient if bad habits are found, which would include toothpaste selection, tobacco and nutritional counseling, and treatment planning. Treatment planning for patients with special needs is usually conducted by the hygienist during the cleaning and includes a patient-specific solution to any problems that the patient may be facing. This brings me to my final point about daily brushing and flossing. Brushing and flossing your teeth is a very important part of your dental care routine. When you don't brush your teeth, plaque begins to form along the gum line and spreads to other parts of the teeth. More than 300 types of bacteria make up dental plaque. Once the plaque forms, it goes below the gum line because it doesn't want to be disturbed, and it's unreachable below that gum line. Brushing your teeth messes up that plaque formation, which will otherwise keep on accumulating since no mechanical action is present to help to stop the process. Once you've gone a couple days without brushing your teeth, you might develop gingivitis, which is basically the inflammation or the swelling of your gums. Your gums may even bleed afterwards. This is still curable with proper oral hygiene, but if it's not treated, you can develop what's called periodontal disease or perio disease. In a study conducted by the CDC, At least 75% of Americans suffer from some type of periogum disease, which is the leading cause of tooth loss for people over the age of 35. Daily flossing decreases the risks associated with those diseases. The purpose of flossing is to basically remove whatever is residual from the plaque that's left behind after you brush. If you don't floss, you miss cleaning 35% of the surfaces of the tooth in the mouth. When you brush, the bacteria will just kind of linger around your mouth, and it will start to go between the cracks and any crevices of surfaces that are not reached or touched by the toothbrush. Once the plaque is between the teeth, the toothbrush can't get there. The toothbrush can't get in between those cracks and crevices. So then it starts to calcify basically between the teeth. Calcified plaque, or calculus, has the potential to build on top of old calculus and then spreads under the gum line, causing other diseases, gum pain, and sometimes tooth discomfort. Calculus can no longer be cleaned by the patient. He's going to have to see a dental hygienist, to remove that calculus that's there. While the calculus is being removed, it might feel like little rocks on the patient's tongue. While I'm quite sure no one here wants to really kiss that donkey, at least you now know that you can brush, floss, get your annual cleaning and yearly exam in order to prevent looking like a mule yourself. After you've taken care of your teeth, smile to let them breathe so then they can take care of you. Thank you.